If the Joint Commission is right, workplace conflict remains a destructive force in too many healthcare organizations. In my years in healthcare, I've personally encountered a variety of trouble situations, including group practices so divided that their partners can't make essential decisions or stick by them, hospitals held hostage by their high-powered specialists whose clinical productivity may be keeping the institution afloat, but their behaviors are terrorizing the entire workforce, critical care units and emergency departments so dysfunctional that day-to-day operations and patient care are routinely compromised. These situations are all symptomatic of unresolved conflict. In some instances, these organizations didn't anticipate conflict, so they hadn't adequately planned for it. In others, ongoing conflict resolution efforts were either insufficient or counterproductive. In any case, conflict continues to divide the clinical care team and sabotage the services they're endeavoring to provide. Contrast that to the personnel in healthy organizations who experience conflict differently. Yes, they still engage in intense, sometimes heated and contentious interactions, but instead of being harmed by it, they are strengthened and unified. Here's what I've noticed about those teams and their healthier handling of conflict. First, they plan for conflict. They realize that conflict is inevitable, even necessary, so they build dispute resolution practices into their organizational culture. This better prepares the staff and workforce for dealing with those stressful situations when they occur. Second, they intervene immediately. These organizations rigorously enforce high standards of conduct and behavior. They also look beyond the personalities to identify the structural contributors to conflicts. Finally, they provide resources. Healthy organizations encourage and empower employees with coaching and training so they can control their responses in the heat of the moment and more effectively communicate in the midst of stressful situations. So what does it take to transform conflict into an opportunity for greater productivity? First, it takes commitment. Change is not easy, requiring new attitudes and new skills. Everyone in the organization needs to be committed to improving the workplace culture. It also requires an investment. Coaching and training and facilitation take time and effort, but they pay off in remarkable improvement in the stability and productivity of your teams. Finally, it takes partnership. Expert coaches and trainers can help your staff develop conflict resolution skills. Professional mediators will ensure that all of the parties to a dispute are engaged in a search for an acceptable solution. Conflict happens in every healthcare workplace, from the solo physician practice to the large healthcare system. The challenge is transforming conflict from a destructive force to a gateway for innovation and improvement. The teams that plan for conflict, intervene effectively, and provide the necessary resources experience engaged practitioners and empowered coworkers, delivering improved patient care. When you're ready to develop the resources that produce that kind of performance, we're ready to help.